how do the kids get bronchitis, and does that happen from the common cold?
It could happen from a common cold, but a common cold is typically caused by a virus.
Okay.
So viral etiology goes away by about 4 to 5 days. Bronchitis is a complication of either a common cold that you had or a bacterial infection. And bronchitis would be inflammation in the bronchioles in your lungs. So you have mucus plugs, and that's a lung infection at this point.
Is that contagious?
It usually is because it's of bacterial etiology, yes, it can be, but not always. A lot of times, yes, it can be by respiratory droplets.
And just to reaffirm, Dr. Constant, when you have a bacterial infection, antibiotics will work.
Yes.
However, viral,
they will not.
They will not, okay. Now, there are a couple factors that may put you at greater risk for developing bronchitis. The first one we see here is chronic sinusitis. So how does that make you more at risk for bronchitis?
Well, chronic sinusitis is inflammation in the sinuses and basically just an accumulation of pus, mucus. And when you have this accumulation of mucus in the sinuses and you have a drip down the back of the throat, a lot of times you can also get this accumulation of mucus in the bronchioles causing the bronchitis.
And allergies, asthma, I mean, especially with allergy season.
Right. All of these are basically the same in that you have a lot of secretions. And when you have continuous secretions that are not being controlled, then it can it can infuse into the bronchioles, cause mucus plugging and inflammation, and that's what would cause the bronchitis.
Okay. And this is a big one, secondhand smoke.
Right, secondhand smoke now irritates the alveoli and the bronchioles, and when you start to irritate them, their inflammatory response occurs, which is going to cause the bronchitis.
So how do you treat bronchitis?
Usually with antibiotics, and it depends on the patient and their symptoms, but sometimes even a bronchodilator like albuterol.
So so can we talk about albuterol? It's very common, something that doctors prescribe. So what does it exactly do?
Albuterol is a bronchodilator. What that means is that when your bronchioles start to spasm or even close, the albuterol will open them up, soften them so you can take a nice deep breath in and expectorate.
Okay.
So it helps you open up and get the mucus out.